Good morning, good afternoon, or good evening. Whenever you may be watching this, hello to you. My name is Chandra White Cummings, and I have the privilege actually, and I'm very excited to do a talk for the sickle cell warrior and caregiving community. And what I want to talk about is caregiving best practices for the long haul. Um, I hope that as we go through this, you will get a good picture of what it takes in order to maintain your stamina, maintain your energy, and maintain your commitment to giving the best care that you possibly can over time for your sickle cell warrior. Because after all, that's the whole point of it, right? So, the first thing is when you first become a caregiver, especially for a sickle cell warrior, you can understand right away that caregiving in this arena is a marathon, it's not a sprint, meaning that you want actually your caregiver, your sickle cell warrior, to have as long and productive and as fruitful a life as possible. So, therefore, even though your caregiving may change over time, you do want to understand and recognize at the very beginning. So, meaning when you first get that diagnosis, that this is going to be a long haul. So, if at the beginning you start off on your journey knowing that this is not going to be over in a month, it's not going to be over in 6 months, it's not going to be over in 6 years, then you can begin to develop the proper mindset. Because I'll be honest with you, I have read a lot of caregiving materials. I've read a lot of advocacy materials, and being a caregiver of 30 plus years now, which is kind of crazy, but it's true. Being a caregiver of 30 plus years now for a sickle cell warrior with SS disease, full blown, I can tell you that your mindset is going to be either your most important asset or your greatest liability. So, first, what's the first thing I would suggest? The first thing I would suggest is that you spend as little time as possible in your caregiving in what I call survival mode. Survival mode is when, and you can feel it when you begin to go into survival mode. Survival mode is when you lock down emotionally, sometimes physically, and definitely mentally. And when I say you lock down, it means that you begin to um, close in and you close off yourself and you think to yourself, I cannot do anything else. I cannot think about anything else. I cannot worry about anything else. I just have to focus on this one thing. And some indications for you that you might be hunkering down and going into survival mode are your daily and normal routines get interrupted. So you might not be doing the same things that you're always doing. You might not be doing them the same way. You might be eliminating things that are actually beneficial to you. So you might stop exercising. You might stop socializing with some of your, personal contacts and social contacts. Now, on the practical side, we know that, for example, let's say your warrior is going to have to be hospitalized, so they're going to have to be admitted. Well, I mean, you know that in a certain sense, you are going to have to stop doing certain things. Like, maybe you're not, well, nobody's doing this during pandemic, but let's think pre-pandemic for a minute. Maybe you're not like sitting at Applebee's, over a long dinner or something like that, but you can still take time to eat. You can still take time to, maintain your basic personal routines. Whatever is going to keep you stabilized, definitely keep those things. But survival mode goes beyond just keeping the basic things that you're going to need to make it through this, whatever this episode is, whether it's a crisis that's being managed at your home or whether you're actually having to, your warrior is actually having to be hospitalized. So survival mode mentally, though, it short circuits your creativity because you narrow your mental focus to one thing, which is I need to get through this hospitalization. I need to help my warrior get through this crisis. And as I've just stated, because I wanted to be clear of what I'm saying and what I'm not saying. So as I stated, yes, you want your attention on that. So you don't want to be distracted, but at the same time, you do not want to shut yourself off from a brain and neurological and cognitive standpoint. You do not want to shut yourself off from the mental functions that will allow you to think creatively, to problem solve, to make decisions. You need vision, meaning you need to be able to see yourself out of this situation that you're currently about to go in. If all you can think is day to day, like he's in the hospital, he's in the hospital, he's in the hospital, he's having a pain crisis, he's having a pain crisis, he's having a pain crisis, he's got a spleen, if that's all your brain is producing, then that's all your brain is going to enable you to do. So, for example, um, there was an instance, an episode where my warrior had a hospitalization, and I could feel right away that I was like what I call white knuckling it. Like I was starting to close myself in, like, okay, this is all I can think about. I've got to make sure of this, I've got to make sure of that. And I, after a couple of days of that, I realized that simple decisions I was having trouble making. Simple decisions like, do I want him to have Tylenol or do I want him to have ibuprofen? Do I want to stay at the hospital most of the day or do I want to stay a little bit of it and go home? I mean, these are all decisions that have to be made. And I was having trouble really making them because all I thought about was that one thing. He's in the hospital, he's in the hospital. So, my suggestion and my best practice is to spend the minimal amount of time possible in survival mode. Resort to it only when absolutely necessary, meaning you have a serious crisis on your hand. For example, my warrior happens to have experienced several bouts with acute chest syndrome. Acute chest syndrome, as the whole community knows, is a really serious issue. It's a serious episode. So, if a couple days you've got to, or a day or so, you've got to really just go into survival mode because, there's things that are really, really critical happening, then do that. But spend as little time there as possible. As soon as you emotionally and mentally can, transition out of that mode into just a regular, life operational mode, which means I'm going to evaluate my options carefully and thoughtfully and with due consideration. I'm not going to rush. I'm not going to make decisions under pressure. I mean, I'm not going to be pressured into making decisions because you will need that mental and emotional flexibility. Okay, so that's number one. Number two, and this one might seem a little difficult for people, so I will take a little bit of time to explain this. Caregiving best practice for the long haul, number two, is don't over identify with other people's experiences of mistreatment, discrimination, or neglect in the healthcare system. And what I mean by that is, when first of all, as African Americans, we kind of operate in advocacy and group mode almost all the time. We were all socialized and all raised to think not just of ourselves, but of other people as well. And that people in that other group it could extend as far to your extended family members, your community, your church, congregation, people that you go to school with, so on and so forth. So we've been socialized and we've been taught from very early on, it's all of us. We all think about one another. If so and so gets arrested, then we're all arrested. If so and so, gets mistreated by the cops, we're all mistreated by the cops. If so and so goes into the hospital and has an absolutely horrific experience in the ER, then we've all had that experience. So from a sociological standpoint and from a community socialization standpoint and advocacy standpoint, we totally understand that mindset because we have to look out for one another, right? So that's a reality. But what I'm referring to here is when we do what I call borrow victimization, which means, excuse me, which means that we identify with another person's experience. Excuse me, I totally apologize. It means that we empathize with another person's experience to the point of, I'm trying to think of how to say this exactly the right way so it's not offensive, but we cannot actually behave and internalize. I'm going to I hate to do this, but I have to get something to drink because I cannot. Okay, totally unorthodox, I know. So what I mean by this is that when we over identify with someone else's experience, we really do take on the emotions and the emotional attachments that go along with that person's experience. So this is how it plays out. Somebody that you know in the sickle cell community has had a hospitalization. They went in through the ER. They had a bad experience, a really bad experience, maybe. Maybe they were there for hours and hours and hours, which is not uncommon. We all know that. Maybe the ER doctor who was assigned to them, the attending and or the residents were completely unwilling to consult with the PCP or with the hematologist or with another specialist that was needed. Maybe a number of other different types of things happen. So now you hear about this and you begin to think to yourself, dang it, see, that's what I'm saying. You cannot trust those people. Like, when you go in there, I mean, you have got to be fill in the blank. So all of this resentment, all of this angst, all of this anxiety begins to build up, and your person is not even in the hospital at this particular time. But the next time that comes around, when your person may be in the hospital, I can almost guarantee that you're going to find yourself referring back mentally and emotionally to the other person's experience. And so now you're going into your own experience kind of loaded for bear. You're like, yep, I'm ready. And that sends off signals to people. It sends off signals that says, I know what's about to happen here. I know what's going to be going on, and I'm not having it. Now, I am not saying that you go into your situations naive, thinking that, woo, nothing bad will ever happen. No, we'll never have a negative experience. That's not what I'm saying. But what I'm saying is the best way to spread and to extend our individual advocacy is to keep ourselves in a place emotionally where we can have experiences and we can gain insights that will actually help other warriors and caregivers in our community. So, how does this work out? So, the way this works is, let's say we have the same scenario I just explained. You heard about somebody who went in, had a bad experience, which unfortunately, we all know that it happens and it happens too much. So, let's say you've heard about it. Now, your warrior is having a pain crisis, and it's not one that you feel comfortable managing at your home or your residence. So you've come to the point now where your person has to go in. So instead of going in what I call loaded for bear, you go in prepared, meaning you have your notebook or you have your phone or whatever tablet, whatever you use, and you're ready to be observant. You're ready to document and take appropriate notes. You're ready to interact with whoever comes to you, whether it's that attending who is not very attentive. Whoever comes to you, you're going to be ready. So we want to prepare, but we don't want to come in with a victimization mindset. It will definitely keep us from having those experiences from which we can gain insights and then which we could then, spread to our entire community. So it's really in our best interest not to over identify with everybody else's bad experiences. Next, and this kind of goes along with the other two because they all have to do with your mental and emotional status and state and strength. Guard and reserve your emotional and mental energy. This is so critical. I couldn't decide to make this one number one or the one about spending minimal time in survival mode number one because they are both so critical. But you have to guard your emotional and mental energy, meaning don't waste time dwelling on resentments, failures, disappointments that have happened to you personally in the past. So when you go in for that admission or you go in for that next provider appointment, try very hard not to dwell on what happened the last appointment or what happened the last admission. Be prepared, as I just said. So think about those things that you want to try to prevent from happening this time, but don't dwell on the fact that you were just like livid about so and so, or the fact that, you know what, man, last time this happened, I really didn't do what I needed to do in terms of ABC. Don't dwell on what you think are your own failures or the system's failures or whatever disappointments you might have had in the past. Simply gather whatever learning and knowledge and insight that you need from those experiences. Take those with you, leave the resentment, the failure, and the disappointment behind, and then walk into whatever your situation is prepared. If a situation that happened to you in the past warrants it, then advocate. So, begin to, write your letters, begin to follow up with providers who were involved in whatever the incident is that you feel that you need to advocate. Do those things and put your power there. If it doesn't, if you really think about it and you think, you know what, it was a doctor visit and so such and such happened and I'm just gonna, it's not worth me doing letters and all of that sort of thing, then just let it go. That's the simplest thing I should say to you. Just let it go. And this is really, really can be very difficult because when someone close to you, a child or a spouse or just some other family member is involved in these situations, it can really take an emotional toll, especially over time, because over time, now you're building up emotions and you're building up experiences from 5, 10, 15 years ago. I mean, as I said, I've got 30 years worth of experiences, and I feel sometimes like I haven't forgotten a single one. But every time something comes up, right away I start working on. Don't worry about what happened in Ohio when somebody forgot to take an IV out or took it out halfway, and you walked into the room and there was blood spurting out. Don't dwell on that, because it will put me in a really bad emotional state so that I can't do what I need to do for my warrior at this present time. And it will also have a really deleterious effect on me over time. All of that stored up, anger and frustration and all of that, it takes a toll on our bodies and on our minds, and on our emotions. And these are not things that we can afford as we move forward in year after year after year with our warrior. We must remain at our best physically, emotionally, and mentally. Next, the next caregiving best practice for the long haul that I would suggest is become a skilled advocate. Not just a fusser, not just a complainer, but become a really skilled advocate. And we all know, whatever your job is, whatever your life experiences have been, we all know that it takes time and investment to become skilled at anything. So what better, place to put our time and our energy and even our money than to become a skilled advocate for our warrior. So, do what you have to do in this regard. Um, the consortium has a fabulous, Warrior University. Awesome. It's right there. Take advantage of it. Take another online course. If you just find an online course that just has to do with advocacy in any setting, I highly recommend it. Um, Observe people who get positive and productive results with their advocacy. So if you know other parents or other, family members or even other warriors who seems like they get good results, they maintain a good rapport with their providers. um, they have a good reputation in the community, things of that nature. See exactly what it is they're doing, and then try to emulate that, in your context and for your personality and your situation. The other thing that I would suggest in this regard is to really get out there and find and study advocacy resources. One of the best things that we can do for ourselves cognitively and skill wise to diversify our skill sets as caregivers and advocates is to look to other industries that might involve advocacy work and learn from them too. So I'll just use myself as an example. Okay, so as a lawyer, that's really what you're doing. You're advocating, advocating, advocating. So I go to legal stuff and I see what do they say about a good advocate. So just as an example, a lot of people think that being a good advocate means being somebody who can argue or somebody who likes to argue, or somebody who, kind of thrives on conflict or certainly doesn't mind it or seeks it out. Well, those in fact are not good traits for skilled advocates. Skilled advocates, and advocates who get positive and productive results with their advocacy are those who are able to maintain a certain level of objectivity in what they're doing. Now, before you click me off or put me on pause or whatever, drag me, just consider what I'm saying, because I know when your kid is laid out and cannot advocate for themselves, and you want things done well and done right, we're not necessarily being all objective, and all of that, but we have to discipline ourselves. And I have found this rule of caregiving. It's an inverse rule of advocacy in caregiving, which is this: the more serious and the more pressure a situation involves, the more objective we have to be able to become. And when I say objective, I don't mean like you're going to allow other people to just do everything that they want to do, and you're not going to insist on having any of your warriors' needs met. That's not what I mean. What I mean is that you balance your emotions with other skills. So with your listening skills, with your reasoning skills, and all of that. It has to work together. If we allow the emotion side to be dominant all the time, then those other things that I just named, they're going to fall a little bit more by the wayside. So part of being a skilled advocate is being able to discipline ourselves to maintain a certain level of objectivity, meaning I'm concerned about my person, but I'm also willing to consider what your concerns are as well. Because in the end, what we want is excellent care. And we cannot get excellent care if the doctors do not want to deal with us, or if the nurses do not want to deal with us. So it's a fine line, but that's part of why it's a skill. And there's an art to it as well. So the point is, do it in more of a formal way. Take a course, observe people, talk, even talk to people, or have conversations with people about what have you found, kind of like what we're doing right now. What have you found works best? What did you find like totally blew up in your face? Those kinds of things are really, really helpful. Um, Next, when you're a caregiver for a sickle cell warrior, over time, as I said before, the episodes that you're involved in will accumulate. So, generally speaking, people with sickle cell disease have lots of specialists. They have hematologists, neurologists, they have primary care physicians. They may have an orthopedist if they are post-stroke. So they could have all kinds of providers in their circle and in their orbit, and which means you've got lots of visits. You may have lots of hospitalizations. You may have some serious hospitalizations. But the point is, there are a lot of things that go on. There are a lot of episodes that happen in the life of a sickle cell warrior. Over time, this can begin to erode on you. emotionally and physically. And you just find yourself kind of like wearing down, and you find yourself like taking longer and longer and longer after each episode to just kind of reset yourself and get back to kind of your normal way of being, your normal way of operating in your life. When my warrior was younger, that happened to me a lot because I happen to be the kind of person who has an emotional makeup that does tend to dwell on things. So, see, all of these things that I'm telling you from straight up experience. There are things that, like hard lessons, I've had to learn, and I've seen the difference when I've been able to change and adapt to our situation. Because we happen to have had a really intense and some serious things that have happened in our warrior journey. So I've really had to learn these lessons. So I just want to say that like I'm not just talking stuff that I heard somebody say or whatever. These are things that I really have lived. So my suggestion here is don't let any one thing wipe you out. And related to that, recover as quickly as possible from whatever the hospitalization, whatever the setback is. Recover as quickly as possible as you can so that you can continue to provide the best caregiving you can to your warrior. Stay abreast of treatments and trends. We have some very exciting things going on in the sickle cell community right now in terms of promising practices and promising treatments. Legislative things are going on in the legislative arena, and it really is very exciting, especially for a family like us who have been in this a long time. To see some of these things happen now is really gratifying. But we have to stay up with what's going on because it's another area of advocacy for our warrior. If there's a treatment out there, we at least want to begin by knowing what is it, what does it do? What does it not do? How does it work in the body? Is it something that's short term or long term? How do we access it? That means cost. How do we get a provider who will administer this treatment? So on and so forth. So we have to know what's going on, and we have to, and we can do that any kind of way we want. They just had a big 60 minutes segment about sickle cell. Well, I watched it. To me, that's part of what I'm doing to stay abreast. If you're kind of a policy nerd or whatever, then dig into the policy aspect of this. Whatever works for you, then do that. The other thing is, it is really, really productive and meaningful to stay intentionally inspired. I personally believe that the sickle cell warrior and caregiving community, there are some of the most inspiring people I've ever met in my entire life in this community because, for lack of a better way to put it, we just keep going. But not only that, but there's so much creativity and there's so much innovative thinking. And I mean, just take this convention as a example. You know, Brandon and I are completely geeked about this murder mystery thing. I mean, that takes, productivity, and it takes creativity. So I stay intentionally inspired, meaning I look on purpose for things that are going to inspire me, that are going to uplift me, that are going to spur and stimulate creative thinking in me. Because a lot of times, when you have to get involved with a hospitalization or something, you might be the person who knows the most about whatever the condition is that your person has, like secondary conditions, like if they have moya or if they have seizures or things of that nature. You might be the one who knows the most about that. So you've got to be inspired and you've got to learn how to think outside the box. Well, to do that with all the pressures that we have, you have to do it on purpose. You have to seek out opportunities to be inspired. The rare disease community at large is another place of awesome inspiration. So, people that have other rare diseases, cystic fibrosis, um, Barr's disease, Parkinson's, all of these things that are very, very serious conditions, seek out those communities and see what are they doing to keep each other uplifted? What are they doing to, spread, for lack of, I know sometimes joy sounds like a cheesy word, but what are people doing to give themselves joy and to help spread joy in the disease community or the care community that they're a part of. Sometimes people will send, like I'm a part of different communities where we're always sending little, memes. We're always sending gifts. We're always sending just, we do group chats and messaging because we have to stay uplifted. There's so much to press us down. But I, on purpose, seek out inspiration daily. I'm just going to be honest, every day. Okay. And lastly, but not leastly, plan as much as you can for transitions, like known transitions. So puberty is a big one. Um, Young people, when they're going through puberty, that's kind of an intense time anyway, without a serious disease to worry about. So, excuse me. So when you can, build in some time, maybe on the weekend, when your warrior's healthy, on the weekend, spend an hour or two just thinking about, what kind of changes are going to be happening as my child goes through puberty, as they get into adolescence, as they move on. Adult care, that's like a huge topic right now. Because it's so critical and so many people are dropping out of their care because of access issues and things of that nature. So as much planning as we can do, we need to do it for things that we for sure know are going to happen. We know that puberty and adolescence are coming, and we hope they're coming. We know that adult care is going to come. We hope it's going to come. So don't get caught unawares. Squeeze it in when you can, and do the very best that you can with your planning. Again, there are so many more than when my warrior was younger, but there are so many groups out there now. There's Sickle Cell 101, there's Sickle Cell Disease Coalition. Of course, there's the SCDAA at the national level. I mean, there are so many community-based organizations now. There's almost no reason not to be able to get resources to help us plan. My warrior is full-blown adult now, so I've actually passed all of those transitions, and they each had their different little quirks and different little idiosyncrasies about how to deal with it. But plan as much as you can. Take advantage of every single solitary resource that you possibly can, and then just push on, work through it. So I hope that during this discussion, I have given you some helpful practices, best practices that I've learned over my journey of 30 plus years of caregiving for a sickle cell warrior. And I'm looking forward to our conversation when we are able to get together and talk about caregiving and maybe even some of the things that I've said here. Thank you so much for your attention. I really appreciate it. And I'll see you at convention.